Continuing on with cirrhosis complications, you can see the organs, the abdominal organs spread out, with this being the intestines, small intestines. I've redrawn and made sure that annotated the veins that are drawing that deoxygenated blood from the outer portions of these organs. They're all distended in what we call varices or varicosities. That is the basis of kind of the beginning of the next phase in the complication of cirrhosis, which is gastrointestinal hemorrhaging or excessive bleeding. Those varices, varicosities, are increased at risk for rupturing, and especially around the lining of the stomach, especially around this esophageal area. This is a very common site where there may be bleeding either externally and external into the body cavity on the outside of the esophagus, or it may be internal, and then the patient's coughing up blood from their stuff, from kind of their esophageal and their stomach area. There may be bleeding around in the intestines, so there may be blood showing up inside the stool. The reasons behind gastrointestinal hemorrhaging, besides this increased portal hypertension that's occurring, is there's two other very important reasons that that come across that are required to know. So the portal hypertension is one. I'll just write portal PH for portal hypertension. The second reason is thrombocytopenia. So thrombo is platelet, cyto is cell, penia is low, abnormal low in the blood. The reason is the spleen that's now damaged from this and becoming enlarged, splenomegaly, now produces less platelets. It's a major producer of platelets. And if we have a damaged spleen, we will produce less platelets. That increases the risk of hemorrhaging because there's less clotting blood cells. And then the third is less clotting proteins themselves. So the clotting proteins that are involved in the coagulation cascade, there are 12 known clotting proteins. Guess what? 10 of those, actually I think it's 11 of those are made by the liver. And if the liver is cirrhotic and damaged, it's not making those clotting factors. And those clotting proteins that it makes, if it's not able to make them, we have a much more harder time clotting, making much more prone to hemorrhaging. Quickly getting into edema and ascites. The liver also makes a protein called albumin. Albumin blood levels. So albumin is responsible for the gradient of osmolarity between the fluid on the outside of cells and on the inside of vessels and in the inside of our blood. So if there's excessive fluid in our tissues, if we have enough albumin, it regulates it so that fluid is uptake back through the venous system and returns back to the heart, to the lungs, to be reoxygenated. If the liver is not able to keep up with it, the blood albumin level will go down, and that causes fluid retention. That fluid is not able to be reuptake back into the venous system, and that fluid is retained in extremities. So you'll start seeing pitting edema right above the ankles and around the calves. You'll see this excessive swelling going on in edema there. It'll happen in extremities. You may see it in the neck, face. In ascites, this is a combination of edema's lack of albumin as well as the increased portal hypertension. This is seen in kind of the later stages of cirrhosis, as in end liver stage. If a patient has ascites, this is a very, very distended abdomen. It looks very, very large, very rounded abdomen. I will post pictures of all of these complications, but if a patient is presenting with ascites, the survival rate after 2 years is, I can't recall, but it's not as good. It's very difficult to treat cirrhosis after it's reached this level of complication.